Have you ever wondered why some seniors recover quickly from surgery while others never seem to bounce back? Or why a procedure that seemed routine in your 50s now feels like a major health gamble in your 70s? And most importantly, what aren't doctors telling you before surgery after 71 that could change everything? If you're over 70 and facing surgery, you're right to pause and think. The truth is, going under the knife after 71 is not the same as it was in your younger years. Your body changes, healing slows down, and risks multiply in ways most people aren't prepared for. You may worry about anesthesia, fear a painful recovery, or silently wonder, will I come out of this the same person? You're not alone. Surgery after 71 carries unique challenges, physically, mentally, and emotionally. But here's the good news. There are 7 critical things you can do before your operation that can dramatically increase your chances of recovering faster and avoiding dangerous complications. Most people, especially seniors, don't know about these steps, and missing even one of them could mean setbacks that affect your independence, limit your mobility, or lead to serious health consequences. That's why I urge you to stay with me until the very end of this video. I'll walk you through exactly what to do, step by step, so you can go into surgery feeling informed, confident, and in control. Whether you're preparing for a hip replacement, a heart procedure, or even something as minor as gallbladder surgery, this could be the most important health video you watch today. Before we dive in, a small favor. If you find this video helpful, please hit the like button to let me know. And if you haven't subscribed yet, I recommend you do that now and turn on the bell so you never miss out on essential health updates tailored for older adults. If this video speaks to you, comment number 1 below. If you think it could be better, write 0. Your feedback helps me serve you better. Let's begin. 1. Get a full health evaluation, not just the standard pre-op tests. If you're over 70, it's not enough to rely on the usual preoperative checklist. Sure, most hospitals will check your heart and lungs, but that only scratches the surface, and blood tests. But for seniors, that simply isn't enough. What you truly need is a far more detailed and personalized health evaluation. Why? Because as we age, our bodies don't respond to surgery the same way they used to. Even seemingly minor health issues, ones you may have lived with for years, can suddenly have a much larger impact on your surgical risks and recovery process. Many older adults deal with chronic conditions like diabetes, high blood pressure, arthritis, kidney issues, or the early stages of cognitive decline. These aren't minor background concerns. In fact, they play a direct role in how your body tolerates anesthesia, your chances of developing post-operative delirium, and the speed and safety of your recovery. Have you ever considered how your everyday medications might affect surgery? It's not just about prescription drugs, it's about how they interact with one another and with anesthesia. Polypharmacy, or taking multiple medications, is common in seniors, and some combinations can increase your risk of excessive bleeding, infections, or confusion after surgery. Even over-the-counter supplements like ginkgo biloba, garlic tablets, or fish oil, things most people assume are harmless, can interfere with anesthesia or complicate healing if not discussed with your surgical team. There's also a silent risk many don't consider: nutrition. Malnutrition is far more common in older adults than you might think, even among those who appear to eat well. When your nutritional status is poor, healing slows down. Your immune system becomes less effective, and your chances of developing a post-op infection rise significantly. Then there's your mobility and mental sharpness. Seniors who already struggle with movement or show early signs of memory or cognitive decline are statistically more likely to face a longer hospital stay or encounter difficulties in post-surgical rehab. But here's the good news. If these issues are identified early, your medical team can create a personalized care plan to minimize those risks. So what can you do about it? Ask your doctor specifically for a geriatric preoperative assessment. This isn't your standard pre-op checkup. It's a comprehensive evaluation designed for older adults, one that takes into account your medications, chronic health issues, nutrition, physical ability, and cognitive function. When tailored to your needs, this step alone can dramatically improve your safety and your outcome. Shall we move on to the next important step? Let me know when you're ready. This type of geriatric assessment typically includes several key components that go far beyond the basics. Frailty screening looks at your strength, endurance, and how well your body can bounce back from stress. It helps predict how you'll handle the physical impact of surgery. Cognitive testing is another essential piece. It helps detect any early signs of memory issues or confusion that could affect your recovery. You might not think twice about balance or the way you walk, but a fall risk evaluation reviews your gait, balance, and any history of falls to prevent setbacks after surgery. Your medication review is just as important. It looks for potentially dangerous drug interactions or unnecessary prescriptions that could complicate your procedure or recovery. And don't forget nutrition. A thorough nutritional screening will uncover any hidden deficiencies that may slow healing or compromise your immune system. When done right, this evaluation gives your medical team a much clearer picture of your overall health. They can anticipate possible complications and build a personalized plan, not just for the surgery itself, but for the recovery period that follows. Imagine the peace of mind knowing your care is tailored to your specific needs, not just a generic checklist. So, don't accept a simple, "You're cleared for surgery" message and move on. You deserve a comprehensive, senior-focused evaluation that gives you the best shot at a smooth procedure and a full recovery. If you're still here and finding these insights helpful, please drop a number 1 in the comments to let me know you're still with me. Your time means a lot. Now, let's talk about something most people overlook: understanding anesthesia risks for older adults. Anesthesia isn't a one-size-fits-all formula, especially not as we get older. Our brain, liver, kidneys, and heart all undergo gradual changes with age, and these changes affect how the body processes anesthesia. What's safe and simple for someone in their 40s might not be so straightforward for someone over 70. One of the most serious concerns is the risk of post-operative delirium. This is a sudden state of mental confusion that can strike hours or even days after surgery. You might see someone become unusually withdrawn, disoriented, or even agitated. And in some cases, they may not seem like themselves at all. Let's keep going, because what comes next could save you or your loved one from unexpected complications. Confusion after surgery isn't just a passing moment. It can lead to serious consequences. For many older adults, it's not uncommon to experience disorientation after anesthesia, but when that confusion lingers, it can trigger falls, longer hospital stays, or even a permanent decline in cognitive function. Imagine waking up after surgery and suddenly feeling like the world doesn't quite make sense. That's what some patients go through. For seniors who already show early signs of dementia, this disorientation can unfortunately accelerate cognitive decline. And it doesn't stop there. There's also a lesser-known condition called post-operative cognitive dysfunction, or POCD. This isn't a fleeting issue. POCD can quietly affect your memory, focus, and overall mental sharpness for weeks or even months after surgery. In fact, some studies suggest that adults over 70 are especially vulnerable, and in some unfortunate cases, the mental fog never fully lifts, leaving lasting changes in their cognitive abilities. So, what factors increase the likelihood of these complications? It turns out, even mild memory issues before surgery can raise the risk. Taking multiple medications, having a history of stroke or mini-strokes, undergoing a long or complex operation, or receiving high doses of general anesthesia, all of these can stack the odds against a smooth recovery. But there's good news. You can take action before surgery to reduce these risks. One of the most important steps is to have an open and honest discussion with your anesthesiologist. Let them know if you've ever had memory lapses, episodes of confusion, or if anyone in your family has noticed changes in your thinking, even if they seem small. Ask thoughtful, proactive questions. For example, is it possible to use regional anesthesia, like a spinal or epidural block, instead of general anesthesia? These options are often gentler on the aging brain and come with fewer cognitive side effects. Another important question: would light or twilight sedation be appropriate for my procedure? Sedation can be significantly less taxing on brain function while still providing adequate comfort during the operation. Also ask, will I be monitored for signs of delirium or memory issues after surgery? Some hospitals now include cognitive checks as part of their geriatric protocols, which can help catch problems early and improve outcomes. And don't forget to ask if the use of anticholinergic drugs or sedatives can be minimized. These types of medications are more likely to trigger confusion or agitation in older adults. Being informed and asking the right questions isn't just smart, it can change the entire course of your recovery. Your brain deserves just as much protection as your heart, your lungs, or any other organ involved in your surgery. Stay tuned, because the next step in preparing for surgery is just as essential. Older adults should be extra cautious with certain medications, especially when preparing for surgery. That's why an experienced anesthesiologist isn't just a bonus. They're essential. A good one will take your age, weight, kidney function, and overall health into account, carefully adjusting the anesthesia plan to minimize risk while keeping you comfortable. It's not a one-size-fits-all formula. It's about tailoring every detail to your specific needs to ensure the safest possible experience. But even the most skilled professionals can't do it all alone. This is where your support system comes in. Having a trusted family member or caregiver by your side, someone who knows your usual behavior and can speak up if something seems off, can make a world of difference. They can help spot signs of confusion or agitation early and alert your care team right away. Think of them as your personal advocate, guarding your well-being when you may not be in the best shape to do it yourself. Taking the time to learn about anesthesia and making sure the right safeguards are in place isn't just smart, it's essential. It can help protect your memory, your independence, and your overall quality of life long after the hospital stay ends. Now, let's move on to the next critical step: strengthening your body before the procedure. Think of surgery not as a sprint, but as a marathon. And like any marathon, it demands preparation. This process is called prehabilitation, and it's one of the most overlooked yet powerful ways to set yourself up for a smoother recovery. Prehabilitation isn't just for athletes or younger folks. In fact, it's especially important for seniors. Why? Because aging bodies lose muscle mass, balance, and endurance over time. And without a little prep work, the road to recovery after surgery can be longer, riskier, and more frustrating. But here's the good news. Just a few weeks of simple movement can make a remarkable difference. Studies show that seniors who focus on building up their strength and stamina, especially in their legs and lungs, bounce back faster, with fewer complications like infections, bed sores, or blood clots. And it doesn't take a gym membership or intense workouts. Gentle daily walks, basic chair exercises, and light resistance training at home are often enough to boost your resilience before going under the knife. What can you do right now? Ask your doctor about pre-surgery physical therapy or home-based exercise routines tailored to your current condition. You're not training for the Olympics. You're preparing your body to heal better and faster. And that kind of preparation is one of the most empowering choices you can make for your future health. Seniors who take part in a structured rehabilitation program that focuses on strength, balance, and endurance before surgery often experience better outcomes across the board. Their hospital stays tend to be shorter. They face fewer infections, and they regain mobility more quickly. Most importantly, they enjoy a higher quality of life during recovery. Even just a few intentional weeks of movement beforehand can significantly boost your immune system, enhance blood circulation, and make those first steps out of bed far easier and safer. Why is this so important? Because the risks of being bedridden after surgery go far beyond just feeling weak. Seniors are more susceptible to complications like pressure ulcers, blood clots, muscle wasting, and pneumonia, all of which can severely slow down or derail recovery. But with some preparation, these outcomes can be largely avoided. What should you do? Ask your primary care provider or surgeon about getting a referral for pre-surgery physical therapy. Many hospitals now offer prehabilitation programs specially designed for older adults. These programs often include targeted leg strengthening routines to help you regain mobility after surgery, balance training to lower the risk of falling, and breathing exercises, sometimes with a tool called an incentive spirometer, to help build lung capacity and ward off respiratory complications. You may also benefit from gentle stretching and flexibility work, which can help reduce stiffness and make everyday movements smoother during recovery. These sessions aren't meant to be strenuous. They're designed to get your body moving in a safe and supportive way, setting the stage for a smoother transition after surgery. And even if you don't have access to a formal program, don't let that stop you. There's plenty you can do from the comfort of your own home. Try walking around the house or yard every day, even if it's just for a few minutes at a time. These short walks help build cardiovascular strength and confidence. Chair-based exercises can also be incredibly effective. Things like leg lifts, seated marches, or repeatedly standing up from a chair can all help strengthen your lower body. Adding light resistance with hand weights, resistance bands, or even a pair of soup cans can make these movements even more effective. Breathing deeply several times throughout the day may seem simple, but it keeps your lungs active and strong, a crucial factor in avoiding post-operative pneumonia. If possible, begin this routine 2 to 4 weeks before your surgery date. And remember, the key here isn't intensity, it's consistency. By dedicating a little time each day to moving and preparing your body, you'll give yourself the best shot at a faster, safer recovery. The better you prepare your body ahead of time, the more resilient it will be when facing the physical stress of surgery. And the faster you'll bounce back. Don't underestimate the power of movement, especially in the weeks leading up to your procedure. Prehabilitation isn't just about staying fit. It's about equipping your body with the strength and stability it needs to handle surgery and recover with fewer setbacks. When your body is stronger going in, it's far more likely to come out stronger on the other side. It's not only about muscle or mobility. A well-prepared body heals more efficiently, has a lower chance of complications, and is less likely to experience post-operative decline. In short, those daily walks or chair exercises, they're your best insurance for returning to the life you love, and doing it with confidence and safety. If you're still watching and finding these lessons valuable, please comment the number 2 below. That way, I'll know you're still here learning alongside me, and I deeply appreciate your time. Now let's talk about something most people overlook: planning your recovery before you even step into the hospital. At age 71 and beyond, recovery is often slower, more delicate, and far more complex than it was in your 40s or 50s. Many people expect to bounce back in a week or two, but the truth is that older bodies heal at a different pace. Muscle regeneration takes longer, energy levels may stay low for weeks, and the risk of complications like infections, blood clots, or even emotional struggles such as post-operative depression increases significantly. That's why proactive planning isn't just a bonus, it's essential. One of the most common hurdles older adults face after surgery is overwhelming fatigue. You might find yourself needing multiple naps during the day, sleeping longer at night, or feeling drained even by basic activities, like standing for more than a few minutes, walking to the bathroom, or buttoning a shirt. Sound familiar? But here's the truth. That's not weakness. That's your body working hard to repair itself. Understanding this before surgery allows you to give yourself grace, adjust your expectations, and be patient with the process. What can you do to prepare? Start by sitting down with your doctor and asking some specific questions. What kind of recovery timeline should you realistically expect for someone your age with your health history? Will you need assistance walking? Will you require physical therapy at home or in a facility? Should you prepare meals in advance or arrange help with bathing or dressing? By addressing these details early, you reduce stress, avoid last-minute scrambles, and give yourself the calm, supported environment your body needs to heal. And remember, recovery isn't a race, it's a journey. The more you prepare for it, the smoother that road becomes. Your overall health and the specific type of surgery you're having will shape what your recovery looks like. Will you be able to walk without help, or will you need someone to assist you with bathing, dressing, or even getting in and out of bed? Will climbing stairs be possible, or will it be too much at first? These are the kinds of questions you need answers to before your operation. Why? Because setting realistic expectations can make the difference between feeling empowered and feeling overwhelmed. The next step is just as important: lining up the support you'll need. Think about who will be available to help you during the first few days and weeks after your surgery. Will a spouse, adult child, or trusted friend be staying with you? If not, would you benefit from hiring a home health aide for a short time? And if you live alone, this planning becomes even more critical. Many seniors recover better with a short stay in a rehabilitation center, where nurses and physical therapists provide round-the-clock support. Others may only need simple modifications like a walker, shower chair, or handrails to navigate their home safely. Now let's talk about food. Your body will need nourishment to heal, so don't leave meals to chance. Before surgery, stock your kitchen with easy-to-digest, nutrient-rich foods. You might also consider a meal delivery service, senior nutrition program, or even help from a neighbor or church group. And if you follow a special diet, for diabetes, high blood pressure, or allergies, be sure your meals are prepared accordingly. The last thing you want during recovery is a dietary complication. Finally, let's not forget emotional well-being. Recovery can feel surprisingly lonely, especially when your mobility is limited. Being stuck indoors or unable to do what you enjoy can wear on your mood. That's why emotional support is just as important as physical care. Schedule regular phone check-ins with loved ones. Invite friends to visit if you're up for it. Or consider joining a virtual support group for seniors going through surgery recovery. Staying connected to others helps lift your spirits. And a positive outlook is powerful medicine. By putting all these pieces in place before your operation, you not only ease the stress of recovery, but you also reduce the risk of preventable complications, like falls, poor nutrition, or emotional decline. It's about setting yourself up for a safer, smoother, and more confident healing journey. Some complications after surgery can be challenging for anyone, but for older adults, they can be downright dangerous. One of the most serious threats is infection. And we're not just talking about the surgical site. Seniors are at higher risk for wound infections, urinary tract infections, and even pneumonia. These can sneak up quickly and worsen fast if not detected early, potentially leading to hospitalization or worse. And then there's the issue of pressure ulcers, more commonly known as bed sores. When seniors spend too much time lying in bed or sitting without movement, these painful sores can develop, especially over bony areas like the heels, hips, or lower back. Once formed, they can break the skin, become infected, and create a major setback in your recovery. What makes them especially dangerous for older adults? It's the combination of thinner, more fragile skin and a slower healing immune system. As we age, our skin loses elasticity, making it more likely to tear, while our bodies become less efficient at fighting off infections. Even a small cut or open area, if neglected, can quickly become a serious problem. That's why infection control and skin protection should be top priorities before you even leave the hospital. So what should you do? First, before discharge, make sure you or your caregiver speaks with your nurse or doctor about proper post-surgical hygiene. You need clear step-by-step instructions on how to care for the incision site, how to safely change any dressings, and how to recognize the early warning signs of infection. These might include increased redness, swelling, warmth, pus, or a sudden rise in body temperature. Don't wait until something feels wrong. Catch it early. Just as important is movement. The moment your doctor gives the green light, start moving. Even if it's just a slow walk around your room. Taking a few steps every hour keeps your blood circulating, reduces the risk of blood clots, clears your lungs to help prevent pneumonia, and even helps your wounds heal faster. Think of movement as medicine. A little at a time goes a long way. Preparing for these risks with awareness and the right strategies can make your recovery safer, smoother, and far less stressful. Moving your body after surgery isn't just about regaining strength. It's also one of the most effective ways to prevent serious complications like blood clots. Gentle movement keeps your circulation flowing, reduces fluid buildup, and helps prevent pressure from building up in one spot, which is key to avoiding painful bed sores. But what if you're bedridden or need to stay in one position for long periods? That's when repositioning becomes crucial. Don't hesitate to ask your caregiver or nurse to help you change positions every couple of hours. It may seem like a small thing, but even slight shifts in your posture can make a big difference. Specialized cushions or pressure-relieving mattresses can also go a long way in protecting vulnerable areas like your hips, heels, and tailbone. Think of them as tools to safeguard your skin while your body rests and heals. And here's something I can't stress enough. Never ignore what your body is trying to tell you. Too many seniors try to tough it out, not wanting to bother anyone with complaints. But early warning signs like a fever, increased pain, redness, or unusual swelling are not minor. They could be the first signs of a serious infection. Speaking up right away can turn a potential emergency into a manageable issue. By staying alert, advocating for yourself, and getting the right support, you give your body every opportunity to heal safely. You protect not just your health, but your independence and peace of mind. Now, let's talk about something equally important: your mental and emotional readiness for surgery and recovery. Healing isn't just physical. Too often, the focus is solely on managing pain, regaining strength, and avoiding infections. But what about the emotional toll surgery can take, especially for those of us over 70? The truth is, surgery can stir up a lot more than physical discomfort. Many older adults feel emotionally vulnerable after an operation. You might find yourself feeling anxious, unusually sad, or even a bit detached. Losing a sense of independence, having to rely on others, or just being out of your normal routine can leave you feeling off balance. And the longer the recovery takes, the more these feelings can intensify. Research shows that post-operative depression is not uncommon in seniors, especially when recovery feels slow or frustrating. It's not a sign of weakness. It's a human response to stress, pain, and uncertainty. Recognizing these emotional shifts early can help you manage them before they take a deeper toll. By preparing yourself mentally and emotionally, just as you would physically, you'll give yourself a better foundation for recovery. And remember, healing happens in more ways than one. You deserve care, compassion, and the space to rest and rebuild mind, body, and spirit. If your recovery stretches on or you face difficulty moving around afterward, you're not alone. This situation becomes even more emotionally challenging for older adults who live by themselves, feel socially disconnected, or lack a strong support network. In those quiet moments, it's easy to feel discouraged, to worry that you've become a burden, or to fear that you'll never return to your previous level of independence. These emotions can sneak up on you, even if you felt prepared at first. But here's the truth: feeling anxious, sad, or vulnerable after surgery is completely normal. Still, normal doesn't mean you should ignore it. So what can you do to take care of your emotional health before going into surgery? Start by having an open, honest conversation with your doctor. Don't just ask about how long the wound will take to heal. Ask about how the recovery might affect your mood, your confidence, and your sense of self. Are feelings of sadness common? How will you know if what you're experiencing is typical recovery fatigue or something deeper, like depression or anxiety? When you're informed in advance, you're less likely to feel blindsided and more equipped to face challenges calmly. And don't keep those thoughts bottled up. Share how you're feeling with a loved one, a close friend, or someone you trust. Let them know if you're feeling uneasy, frightened, or just not like yourself. You might be surprised at how powerful it is to simply put your emotions into words. Even a brief conversation can lift some of the weight off your shoulders. If you prefer connecting with others who understand what you're going through, consider joining a support group, either in person or online. Hearing firsthand experiences from other seniors who've faced surgery and come out the other side can offer reassurance, guidance, and a sense of belonging. Are you part of a faith community or social group? Don't pull away during your recovery. Lean in. A quick check-in call, a friendly visit, or a shared prayer can nourish your emotional well-being in ways that medicine alone cannot. Above all, be kind to yourself. Recovery is not a straight road. It has its ups and downs. Some days you might feel like you've taken 2 steps back. That's okay. Healing takes patience. Celebrate the small victories. Whether it's standing a little longer, eating a nourishing meal, or simply sitting up with strength, that progress matters. Your mindset can be one of your strongest healing tools. Stay hopeful, stay supported, and know that brighter, healthier days are ahead. Staying connected and reaching out when you need support is just as essential to your recovery as any medication, surgery, or therapy. Don't underestimate the healing power of community, encouragement, and honest conversations, especially during a vulnerable time. Now that you've discovered these 7 essential tips to prepare for surgery after 71, take a moment to truly reflect. Which part resonated with you most? Was it the importance of strengthening your body beforehand through gentle movement and prehabilitation? Or perhaps the overlooked risks of anesthesia and how it uniquely affects older adults? Maybe it was the reminder to care for your emotional health, just as much as your physical body. We'd love to hear your thoughts. Please scroll down and share in the comments. One thing you learned today that you plan to apply in your own life, or maybe pass along to a loved one. You never know. Your insight might be exactly what someone else needs to feel hopeful, informed, and empowered before their own procedure. If you found value in this video, don't forget to like, share, and subscribe to our YouTube channel. Your support means everything and helps us continue creating meaningful content tailored just for you. Wishing you good health, lasting happiness, and peaceful days ahead. And remember, subscribe to Healthy Aging Blueprint so you never miss the information that matters most.